Hi, it's Tara. I hope everyone is doing well. So today is July 11th, 2023, and it has officially been a year and 5 days, right? A year and 4 days since I was diagnosed with facial paralysis, which I've been calling Bell's palsy for a long time now, and I'm trying to get out of that habit just to be accurate, because technically what I have is not Bell's palsy. It is Lyme's disease induced facial paralysis. So again, I think it's very similar, but different as far as how you, I guess, potentially might get it. Mine obviously is from getting bitten by a tick that had Lyme's disease, and then the inflammation, and then having my face get paralyzed. So anyway, yeah, it's been a year. And if anybody has watched all my videos thus far or seen some of my videos thus far, I've been, tracking this journey since the very beginning. I guess I have a lot of things I could say about it. In some ways, it feels like a lifetime ago that this happened to me. In other ways, I still kind of resist the fact that my face isn't the way it used to be. Sometimes I accept the way that my face is. So I, kind of go through the gamut sometimes of feelings about it. But I would say in general, and hopefully this gives anyone hope that is dealing with this condition, especially in the early stages, is one, most likely you won't have as severe of a case as I do. I definitely think I'm on the more severe side, but obviously this can be an outcome for some people. But that being said, I still live a very good normal life. And I feel like it's been many months since I felt really self-conscious about going out in public. Obviously if you start to talk to me or if I start to smile a lot, you could tell that I have this condition, but in general, people don't notice at all. And I'm obviously not interacting with people, at the grocery store or whatever in general. So I live a very normal life. And it really, this facial paralysis really doesn't stop me from doing all the things that I want to do or experiencing all the things that I want to experience. So I guess if anything, I hope that gives people some hope that even if you get this really bad, this condition, it still isn't as bad as maybe, especially early on, your mind might want to start to catastrophize that it's going to be. It will get better. It will. So I guess that's kind of my very brief kind of recap of the past year. I've learned a lot. I have felt a lot regarding this. I think I've changed a lot, hopefully for the better, I'd like to say. Definitely has tested my resilience and my ability to be optimistic. And I like to say that I've maintained both of those things for the most part throughout this experience. And if anything, I like to think that I've been a good example to people in my lives, my children, my nieces, that you can deal with something really difficult and you could still be brave and put on a smiling face and live your life. And so I like to think that overall I've done a good job with that. Not to say that I haven't had my moments, but I think overall, I have. Anyway, moving on from that, just a few kind of tips and tricks that I have gleaned over the past month since I last posted. So I think I mentioned in my last video that I went to go see the facial nerve clinic again, this time to get Botox. So I had my first treatment of Botox about a month ago at this point, and I'm going back in a couple more months because unfortunately with Botox, whether you like it or you don't like it, it's temporary. And so I think overall I will say that I liked it. I definitely did not go into it with high expectations. And I think that if you ever, that's probably one of the best pieces of advice with this journey is just roll with the punches as best you can. If you start putting too much expectation on something or too much weight on an outcome, you very likely could be disappointed. So I went into the Botox thinking, all right, we'll see. I was fortunate. It's covered by insurance. It probably wasn't going to make it look worse. And so that's kind of the mindset that I went into for it. And yeah, I mean, I guess my feeling about the Botox, I never have had Botox before. So this is my first experience. So one of the things that I was surprised by was that the doctor, so my paralysis is obviously on this side of my face, but the doctor actually did some Botox on the normal side of my face. Particularly if I recall, like in my forehead area, because of the fact I still don't have movement up here at all, really, in my forehead area. And so I have no wrinkles over here, which, really great, I guess. Not the way that I wanted to have no wrinkles, but I guess I'll take what I can get. And so he put Botox in this side of my face, so I don't have any wrinkles over here now either. And that way, this side matches this side. So he did some of that where it's like he treated my good side with Botox, probably the areas that I have like the crow's feet and the wrinkles, because over here I don't have as much of that, and so they just look more even to the eye. And then he also did Botox on this side with the intention of loosening up some of the tightened muscles, that synkinesis. And so, like, for example, in this area here, this line was getting really deep, probably because my face, because of the synkinesis, my mouth constantly wants to like pull over here. So there was a pretty deep groove in this area that didn't match the groove on this side. So he did some Botox over here to, I think, kind of to paralyze that muscle, and in other words, kind of loosen the synkinesis in that area. So he did some Botox here. He tried to do a little Botox under my eye here to help with the closure, because as you can see, I can close my eye for the most part. Though you can tell when I close it, I know it's not fully closing. And I can feel, because of the synkinesis, the pulling too in my mouth. So anyway, but I still, the blank still is a full blank. It's probably a partial blank. So I'm still relying pretty heavily on my eye drops because of that. And so he did a little Botox into this area. He didn't want to do too much, because I guess if you do too much there, it could actually exacerbate the dryness of the eye. But I think the idea was to maybe loosen some of that muscle to help with the closure. And unfortunately, I didn't notice any improvement with that. So I think, kind of just looking at my face, sorry, I actually did a before video, but because I am not savvy with this technology and I'm a little lazy about it, to be honest with you, I didn't put in that before shot that I did, or the before video that I did right before I went in for the appointment. So hopefully you can, if you want, you can compare it to my last video and kind of just see, what you think, if it helped at all. I think it did. Again, there weren't any miracles performed, but every little bit of improvement is improvement. So I have to look at it that way. So I'm going to not talk for a second and let you kind of see. My smile is still the same though. Still the synkinesis up here. So anyway, it is what it is. I liked it enough that I'm going to go back in 2 months and give it another shot. And the next steps with all of this is probably some surgical procedures. The next surgical procedure would be I don't know how they do it, but basically some loosening of the muscles. If I kind of liked some of the effects of the Botox, they could make that permanent through some surgical options, as well as this titanium plate that I guess they can put into your eyelid to help maybe with the eye closure. That would be really great. So I'm assuming those would be the next steps. Probably not for another 6 months though. Even though I've had this for a year and I'm probably 90% as recovered as I'm going to be. My doctor said that the recovery can go up to about a year and a half. And the good thing is that obviously you will still recover. The bad thing is that the synkinesis tends to also kind of continue to get worse. So I think he just kind of wants to wait for that year and a half period to do anything that would be potentially permanent. And then long term, if I so choose to go this route, which I don't know if I will yet, but I'll have to kind of, cross that bridge when I get to it, would be something called the smile surgery, where basically they take some muscle from your thigh and they do some kind of a surgical thing behind your ear. I don't know. I haven't looked into it, but basically to try and help bring your smile back a little bit, if not fully, maybe. I guess it's very low risk. However, for about, I want to say he said 20% of people that get this done, it's not effective. So anyway, we'll see when again, cross that bridge when I get to it. But that's the Botox. And then I've also continued to see the physical therapist. Up until this point, I've only done virtual sessions with her, but I am going in for it in person. I want to say at some point in August. So yeah, so I think in my last video, I talked about the meditation that she's been having me do, which I think, I don't think I fully appreciated how much I was allowing myself to kind of just let my face do whatever it was doing all the time, especially when I was stressed out. And I still notice this now. When I get stressed, I can feel the tightening more in my face. And I kind of, for a while, just didn't do anything about that. And now I'm trying to be much more conscious of noticing that I'm doing that and just telling myself mentally to relax and just relax my face. And I can feel it. I can feel what I'm reminding myself not to allow all that synchronesis to kick in and just relax the way that my face naturally would have been prior to this happening. I can feel, the difference. And also with my eye, before when I was drinking from a straw, I would totally allow my eye to close, to really close up. And now I have to think about it, but it gets more and more like a habit. I just tell myself, just relax here, relax your eye. And my eye doesn't close like that. So that is really where that mind muscle connection is super important. And so that's where I think the physical therapy and these meditations that I've been doing have been helpful, where they just, remind you just to relax and to kind of think about what does your normal side of your face feels like, and trying to tell your brain that's what's normal. This is not the normal reaction. This is the normal reaction. And try and have that softening, or that they call it melting away feeling of the tightness when I'm doing the meditation. So I try to do that. The summer's tough because I have young kids and we're busy, but I'm trying to do some of them at least once a day. So there's the meditation, there's the exercise that I showed where you stick your finger in your thing here and you pull to kind of loosen these muscles here. There's the pucker, or you kind of pucker your lips and try not to let your eye close. Try to not force it open, but just kind of relax it. Tell it to relax. And you do that about 20 times. And then the new exercises that I learned are actually facial massage. So one is to basically use your fingers to try and massage around this kind of the socket, your eye socket here. And you'll notice, if you've never done this before, especially, that it's really tight. It's almost painful the first time you do it. So you basically are just kind of very slowly, about 10 times, massage the top part, which I find to be the most tight. And then you kind of just work your way around. So you kind of do this way, and then you do this area, and then in here. So the goal is to kind of work around your whole eye. And I can just feel it. It just feels like if you had a really hard workout and you get a good massage, it just feels relaxed. So it feels nice. So I do actually enjoy doing the massages because they just feel good to loosen those muscles. So yeah, so you work your way around your eye there. The other one was to take your fingers and to kind of massage down the side of your nose where you have the paralysis. You could actually do both on both sides at the same time. I'm holding my phone, so I can't do that. But, and you'll just feel that tightness, and it feels really nice to kind of loosen up some of that tightness. So those were two massages that she taught me. And ideally you do them, each repetition or cycle or whatever, twice a day. I've been doing it more like once a day, but anything is better than not doing anything is what I tell myself. And then the last kind of exercise that she wants me to work on is smiling. So ideally start doing it in a mirror and try and not do like a full smile, but just enough that it feels natural and it feels comfortable and it feels authentic. But then really work on kind of softening the synchronesis in that eye so that when you're smiling, you're not just allowing your eye to clamp closed. You're reminding yourself mentally to say, okay, soften, relax. And it's a work in progress. But I can definitely see when you're talking about that mind muscle connection, that working on that exercise can be very beneficial in the long term. So anyway, this video is going a little longer than I planned, so I'm going to cut it off now. But the last piece of advice that I would give, and this is something the physical therapist told me, and I definitely see this firsthand, is if you get your stress level too high. Or I guess I should say manage your stress as best you can. And I know when you're dealing with facial paralysis, it's really easier said than done. But stress, I think, definitely plays a strong factor in that synkinesis, that tightening, that closure of the eye. And if you can be more relaxed, then I think you just give yourself a better chance for a better recovery. So for me, with doing all these exercises, I'm trying not to stress myself out and say, oh my gosh, I was supposed to do it twice a day and I did it. I got, when am I going to find time? Because that's probably counterproductive to the purpose of the physical therapy. So anyway, that is my video for all of you who are dealing with facial paralysis. Hang in there. It will get better. It will. And this is coming from somebody who clearly I'm not quote unquote fully better, but I have a good, happy life, and my facial paralysis very, very little at this point impacts my ability to do that. So you will get there. I hope for you that it's sooner than it's been for me. But it's a journey, and you will get there in the time that is going to be what it's going to be for you. All right. So thank you so much. I hope you have a great day. Bye.